Welcome to the Autism Blueprint Podcast. I'm your host, Janine Hershkovitz, and it's my goal to help you create a more peaceful home while living with autistic and neurodivergent loved ones. Each episode, we focus on a different room in the house and help you create a peace plan for your home. So let's get started. Welcome to another episode of the Autism Blueprint Podcast. I'm Janine, your host, and today we are at the doctor's office talking about selective mutism. And I'm thrilled to welcome Dr. Elisa Shipon-Blum, also known as Dr. E by her patients. She's a leading expert in selective mutism and the president and director of the SMART Center in Pennsylvania. In this episode, Dr. Blum shares her personal journey that led her to specialize in selective mutism, which is a condition that's often misunderstood and misdiagnosed. We'll be exploring the critical differences between selective mutism and nonverbal autism and how understanding these distinctions can significantly impact treatment and support for children. Dr. Blum will also introduce her innovative approach to treatment, known as social communication anxiety treatment, or SCAT, which focuses on addressing the underlying causes of anxiety rather than just pushing for verbal communication. We'll discuss the importance of creating supportive environments in schools, the role of parents in fostering communication skills through structured activities and peer interactions. So if you've ever wondered about the complexities of selective mutism, or if you're a parent or educator looking for effective strategies to support children with communication challenges, this episode is for you. So sit back, relax, and join us as we dive into this important topic with Dr. E. Well, Dr. Elisa Shipon-Blum, thank you so much for being on the Autism Blueprint podcast today. How are you?
I am great. Thank you for having me. I'm so happy and excited.
Yeah, it's great to have you here. I want you to first share a little bit about yourself and what led you to specialize in selective mutism.
Yeah, so I am the president and director of the SMART Center, or the Selective Mutism Anxiety and Related Disorders Treatment Center. It's a whole mouthful. And I'm the director of Communicamp, which is an intensive group training and parent education program. And I'm also the host of my podcast, Unspoken Words. So I became very passionate about this way back when, 30 some years ago, when I was practicing family medicine and always had a special interest in anxiety and children. And, I remember seeing something with Steve Jobs years and years ago about how you connect the dots of your life. Well, I ended up having a daughter who wasn't speaking in social settings, and she was very misdiagnosed. And people were telling me, people I barely knew were just coming up to me and telling me she had everything and anything from autism to traumatized to defiance. And I just knew in my gut that that wasn't my daughter. And so she was a very engaging, chatty child at home, but would just shut down whenever she was out of the home and interacting with people. So as a physician, it was obviously very frustrating to me because no one seemed to know what this was. And there was this tiny little text in my Nelson's Pediatric of children choosing and refusing to speak called elective mutism, selective mutism. And I'm like, well, that doesn't really sound like her because she's not choosing this. She's really struggling. And she would let me know how her voice would close up and she couldn't get the words out. And she felt so scared. That was like an overwhelming feeling, is feeling scared. So
Wow.
I started the nonprofit, the Selective Mutism Association. And from there, just over the years, just started realizing this is anything but not talking, which we'll talk about. And that this is a social communication anxiety. And so I'm super excited to educate your listeners because I think it's an incredibly misunderstood disorder.
Yes, I've experienced that myself. I think when I was in school and my undergrad was in special education and then my graduate work was in counseling, I think we did maybe a chapter on selective mutism. And
I didn't even get that in med schools.
yeah, I mean, there was a mention of it that it could make its way into an IEP, that kind of thing. And a lot of times parents ask me, and I often don't know the answer to this question, that what is the difference between selective mutism and say, a nonverbal autism? How do you tell the difference? Things like that.
Yeah. Well, first of all, I just would like people to understand selective mutism. The term SM implies a child kind of not speaking. And so you focus so much on trying to get the child to talk. They're not talking. What can we do to get them to talk? And so that seems to be the direction, whether it's in school with 504s and IEPs, and so many treatment providers see this as kids that aren't speaking. And sometimes they think it as controlling people, like I'm not speaking. But it isn't that. Mutism is a symptom. And so you have to see it as a symptom. So my medical background, being an osteopathic physician, was why is a symptom occurring, not cure the symptom, because you're going to miss the boat in a lot of
Yeah.
situations. And I've never seen two children or teens with SM that present exactly the same. And I've seen thousands and thousands over the course of my career. This is all I do every day. And so
Mm.
if you see it as a social communication anxiety, and that there's reasons why someone isn't communicating verbally in a setting, and you understand kind of, I have something called the social communication bridge, which are stages of social communication. You can begin to understand them. So you're right. We have a lot of kids misdiagnosed with either ASD and they have SM, or they are diagnosed with SM and they have ASD, or they have both. And I think the
Mhm.
key aspect is, what are these children really like at home? An individual with ASD will have ASD symptoms at home. One of the key aspects of differentiating between selective mutism and autism is that one, SM is primarily an anxiety disorder. It's
Okay.
primarily a social communication anxiety disorder that's anxiety driven, whereas autism is as we know, a neurodevelopmental difficulty challenge, right? So you have to understand that and the symptoms surrounding it. Um, and so that begins to outline kind of how to differentiate it, because kids with autism have autism at home. And although sensory processing is a very big, what we call why of selective mutism, it's also present in autism, but it's definitely a difference in extreme in a lot of situations and how they manifest their sensory. Whereas SM, it's, if they don't have autism, it's more of a highly sensitive nature more than anything. So they're very highly
Oh,
sensitive.
so you could have a child with ASD that also has selective
Yeah,
mutism.
because if you think about it, SM is quite simply is when you're speaking, doesn't have to be appropriate. And that's one of the things that's kind of misunderstood, is that there are 30 to 40% of children with SM that have underlying speech and language issues. And we've done research on this. And what we see is the ability to put your thoughts together to say them is difficult. So, an expressive language disorder. So, if you're asking an open ended, thought provoking question, they have difficulty with that and they may shut down. Now, sometimes it's developmental, Janine, and other times it's going years not having the give and take and back forth of social communication, and they develop an acquired speech and language
Hmm.
difficulty. So knowing that they have that difficulty, that plays a role, because if they have an innate speech and language issue, again, they're going to have it at home too. So it's very important to really differentiate symptoms within the home environment and out and about. Kids with SM don't typically have those repetitive behaviors. They tend to like desire the social interaction, whereas I know kids on the spectrum, there are some that do, but that social puzzle is so confusing, and it's that causes them stress and avoidance, not understanding the social cues. So even when they are speaking, it's that uncomfortableness, that lack of understanding that gets in the way. Kids that have SM, that's a social anxiety kind of presentation, which is the majority. That are the typical presentation is a very highly sensitive individual that has the social anxiety, timid temperament. That's kind of the dictionary case. So you see that kind of very shy appearance, but that's not all the kids. I see plenty that don't seem shy at all. And that's when, Janine, you look at these other reasons: learning issues, processing difficulties, ADHD. So again, you can have a child with ASD, ADHD, and SM. And so the key is to pull it apart. So we do something called the selective mutism evaluation, which does just that. We begin to screen for the whys so that we can and understand their stages of social communication. Are they nonverbal? Are they shut down? Are they nonverbal? Are they using sounds? Are they using a verbal intermediary or a whisper buddy? Are they speaking? Are they speaking one or two quiet words, or are they elaborative, initiative, and expressive? So it's really important to understand their communication patterns and to understand those factors into why they may not be speaking so that you can develop a treatment program and school-based accommodations and interventions.
Okay. So what are some do the treatments differ based on whether it's SM or whether it's a different type of expressive language delay?
Well, so I have developed something called social communication anxiety treatment, or SCAT. And it's been researched, and it's basically a very cognitive approach. It's got a lot of behavioral, obviously, in it, a lot of kind of family systems in there, parenting and all of that. But it's very cognitive, using the bridge, understanding it. And it's really important that you understand how you implement that, because it also helps with give and take and back forth of communication. So if we know that somebody has speech and language, and we do all that testing, speech and language, ASD, full batteries, ADHD, we have to for many actually, because they think it's not speaking, focus on it, and these kids become either worse, avoidant, more anxious. They're also may have difficulty starting completing tasks in school. They're very frustrated. They may act out behaviorally. Like, why is that happening? Right. So we have to be able to
Mm.
differentiate that. So the way you develop the treatment is to accommodate their social communication. We use a lot of visuals, like you do with ASD. We use a lot of scripting. Now, kids on the spectrum tend to need more structured treatment. So although we may do interviews, think of it this way: I don't want to label everyone with SM as shy, because it's missing so many kids and so many teens. But if you
Mhm.
think about kind of a highly sensitive, timid individual, they get overwhelmed in loud, large, lots of people settings. So you're going to build comfort, peer interaction, question them in less crowded, quieter, less overwhelming settings to make the progress. You're going to build comfort. So having a peer, a small group in the classroom, out of the room, play dates. When you have a child with SM that has the anxiety driven, when that comfort is there, Janine, communication tends to occur, especially as parents are implementing the right strategies, like asking a choice question over an interest, using visuals to prompt them, to facilitate the social communication, and training parents how to do that. But kids on the spectrum, even as that anxiety is lowered, you often don't even see the anxiety. They just can't figure out that social puzzle. Some of
Yeah.
them don't want friends. They don't act like they're interested. Parents get very frustrated. They just don't have many don't have that strong desire. But what we do is we work with their interests. For example, I have a child recently who loves birds, loves birds. We will form a get together over interest in birds and maybe going on a bird watch, or another one that loves to bake, can memorize every baking recipe there is. That's what we do, the activity of their interest. And that will form the connection. So many with ASD will be more interested in the activity than the peer interaction. And we have to almost script it out. So
Mm.
many strategies like action plans. Where are you going? Who's going to be there? What can they ask? Common questions. What would be your answer? What could you ask? Formatting interviews, high buy games or goals, back and forth, predicting the common questions. And so by scripting these kind of conversations out, they almost memorize it. They start to take their action plans. So whether you have
Mhm.
SM or whether you have autism and SM, that approach works really well, because it helps them when they're anxious to think about a conversation. But if they really lack that know-how, it structures it for them.
Yeah, that makes a lot of sense. Um, so in selective mutism, I've heard parents say that their children are often misunderstood as being defiant,
Yes.
because they can speak in some situations and can't speak in others. Could you talk about that a little bit?
Oh my gosh. That defiant connection is makes my blood curdle. Early on in
Mm.
my career, I heard this oppositional defiant or now that view of seeing a child oppositional and defiant, that projects onto our highly sensitive kids. And it almost
Mhm.
makes them defiant because they feel so frustrated, so avoidant. So, what if I told you in all the years, 30, I mean, so many years that I've been doing this, I've never met an oppositional defiant child that's purposely not speaking. So, what I would say to your listeners is if you're seeing oppositional and defiant behavior, why is that occurring? Are they a like, do they have sensory processing difficulties and they feel uncomfortable and unsafe in an
Yes.
environment, right? And overwhelmed in that
Mhm.
environment, and they're frustrated, they're acting out, that kind of reaction. Do they feel misunderstood? Come on, you got to talk, you need to talk. If you talk, that frustration, their
Yes.
avoidance. You must see this in your practice with the spectrum too.
Yes, yes, and I despise the, oppositional defiant
Oh,
disorder label. I will not give
I
it
will not. I have never
because
given
we
it
know
either.
something. No, and the parents that come in with their kids and say, "We've had oppositional defiance, we've had, you know, gosh, ADHD, we've had behavior, all kinds of different behavior disorders," because a lot of clinicians just go by what is presented in front of them. Right? And they're not, they're looking at, oh, well, when they're with peers, this happens, but when they're with mom, that happens. And of course it does. I mean, think about us just as human beings and how we behave differently with, someone that we're related to or live with rather than, someone that we've just met.
You know,
It's,
absolutely. And when we do Communicamp, which is my very favorite thing because it's educating parents for 3+ days, it's working with the kids in these school environments in a classroom to teach them skills. The most amazing thing for me is the parent education because I mean, I'm mainly with the parent education. So it's so amazing for me because I see the evolution in parents from the minute they sit down on a Saturday morning, the anxiety they have. But when they start to understand and they see their child different, they project to their child differently. And then their children start to come around. And
yes.
just between day 1 and 2, the amount of change that occurs from parents going, oh my God, I didn't understand this. I didn't understand the social communication bridge, and that, yes, they're nonverbal here. And rather than get upset with them, I can start to understand that we went to Target at 2 o'clock in the afternoon to practice a goal when that was an overwhelming time and they're a really sensory sensitive child. We're going to go during off times. And you know what? I should have scripted it out. The visuals minimize the need to think and process. And if they bring them in by a choice as a first step, they're hearing it. So by hearing
Yeah.
the choice with the right answer second, the visual scripts, playing the games for young children, the scavenger hunt or the give my order game or the interview game or the guess who game or whatever the millions of games there are, you use these strategies to be able to minimize their need to think and process, which lowers their anxiety. And as a result, progress occurs. And then simultaneously, you educate the child to understand where they're at. So it's really amazing to see parents kind of metamorphosize as they learn about this. So that's why I'm excited for your listeners, because there may be listeners that have kids with ASD and SM. And it's like,
Mhm.
wait, how do I tease it apart? It's more of the understanding they coexist and how do we adapt the treatment? Because we use SCAT with autism all the time because it gives the parents the tools, it gives the kids the tools and the structure needed. Kids on the spectrum, as I said, need more structure.
Yes. And it sounds like that structure will work whether it's, SM or whether it's SM with autism
Yes.
or, yeah, that makes a lot of
And
sense.
training those teachers, like in the mornings, going in and having 3 questions answered, 3 questions asked, and knowing that and getting, you know what I'm saying? Like knowing the
Mhm,
hi bye game. Someone says hi, you copy it back. The hi bye
mhm.
copy game, something as easy as that. Some kids start with a wave, it may have to use sounds or shape the sounds into words. Depends. Most kids actually on the spectrum that have SM and ASD don't need as many transitional strategies. That,
Really?
yeah, many kids that have SM without ASD are much more cognitive of that pressure to speak, and they tend to need more of that kind of transitional work and the strategies to unlearn the mutism. Whereas kids on the spectrum, when you adapt their environment, because the comfort tends to be there, They're not so anxious. So
Mhm.
when we see kids in the office, we might transition them kind of quickly with sounds to words as they shape sounds into words. I mean, one of the resources I can give you is the social communication bridge to be able to educate for your listeners just to understand what I'm about the
Fabulous.
bridge. But
Yes.
once they're verbal, it's about keeping them verbal. They stay verbal because it's just how you utilize the strategies. Like, I'll give you an example. I have a child the other day that I saw in the office, and whenever she was jumping up and down and moving, she was able to talk. But because she was sitting in
Yes.
the classroom, Janine, in a chair, she didn't talk.
Right.
So as we noticed, and the parents said the same thing, when she's jumping and moving, she's talking. So our treatment has to understand that. I can't
Yeah.
force her to sit in a chair. Maybe she'll have a wobble chair.
Yes, yes.
Maybe she needs sensory breaks. The sensory component of that is huge. And the movement, that kind of sensory motor relation to communication. So I think what you're hearing from me is it's not just shyness for so many with SM. It's about understanding why they may not be talking and then address those whys and adapt their treatment in all these settings to accommodate the whys.
That makes so much sense, and I would love if you have a copy of the social communication bridge, I can add that into the show
Yeah.
notes, so that people understand kinda what we're talking about. What are some of the mistakes that you see parents and educators make?
Oh, wow. You're asking such great questions.
Like, when they're trying to help, right? Sometimes, when I'm trying to help, I will overwhelm my son, right, with too many questions. So, what are some of the things that you see?
The most common thing that I see is the misunderstanding that this is about getting a child to talk. And there are a lot of young, naive clinicians out there that focus on brave talking and brave talking only without understanding that there's a bridge and that there are factors into why, and we need to understand it. Now, maybe it is social anxiety. Maybe it is just a tad bit highly sensitive. Maybe that is what it is, but maybe they have other reasons. They're processing difficulties, central auditory processing disorder, other processing difficulties, ADHD, other reasons for not being able to take in the information to be able to have a conversation. Maybe they have a expressive language or a speech and language difficulty. Maybe they are on the spectrum. Maybe they're bilingual and they're trying to understand the language that they don't speak at all at home. You see what I mean?
Mm,
So there's so
yes.
many reasons why a child develops this, and we have to kind of rule it out, rule it in, and that's the beauty of the selective mutism eval that we do. We screen for it. And interestingly enough, there are many kids that have sleeping issues, eating issues,
Mm,
behaviors, and toileting issues. I call that the quad. And the more you have a quad of challenges that aren't about not speaking, you end up understanding the sensory component is probably a big part of this and the emotional dysregulation. So, addressing sensory. So, the biggest mistake is focusing too much on talking, Janine, without understanding the child. And if you have a child that is avoidant, frustrated, acting out, seems to shut down more when you're implementing strategies and goals, I'd say to the parents, hey, step back, Jack,
yes.
figure out why it's happening, back up to move forward. And that's the majority of individuals we see at the Smart Center. They're families that have tried either local treatment and focus so much on talking. Now, we do focus on talking when the child is ready. But we see
Yeah.
so many that aren't even engaging, Janine. The simple act of
Mm,
handing and taking, interacting non-verbally with a peer, going up to a peer so many can't even do that. But yet they're
right.
trying to get them to talk, which is only reinforcing their anxiety, and then it causes avoidance and heightened anxiety and difficult behaviors.
So it sounds like what you're talking about is teaching the kind of the rules of communication
Yep,
through those other activities
for
because
sure.
speaking is just words coming out of your mouth. Communicating is so much more.
So much more. The simple act of social engagement, which I know is so important with your population. Many
Yeah.
don't engage. One, we
Yeah.
never force eye contact because eye contact is like daggers going through their eye.
Yes. Thank you for saying that. Say it again.
Oh my gosh, you never force eye contact. It's
Thank you.
torture.
It is torture.
And I don't understand how so many focus on make eye contact, look them in the eye. It's like you're basically saying, Get anxious. We need you to feel anxious because they avoid that. They don't feel comfortable. And that lack of eye contact, well, with autism, it's much more like heightened and exponential. With a child
Yeah.
with SM that doesn't have ASD, the eye contact is a sign they're not comfortable. Look at their body language. There's a saying, look, listen, and learn. It's look, listen, and learn from your child. What are they telling you by even just their body language? What are they telling you in an
Mm.
environment with a certain individual? What are they telling you by their flat affect, their lack of engagement, their stiff body language? They're stuck in the, what are they telling you? And that's what you have to understand and talk to them about. Another big mistake is they don't talk to the kids about this. It's, I don't want to talk to them. I don't want them to know about this. You don't think they know that they don't?
Oh, yes, 100%. I have parents say to me all the time, "Should I tell my child about their diagnosis?" Well, they already know.
Yes, yes. So dealing with what we call the pink elephant in the room, and for us,
Yeah,
it's so easy because we talk about the bridge, the social communication bridge that has the stages of non-communicative, nonverbal, transitional, and verbal, and we break it down for them, and they feel so proud of themselves. So because so many focus so much on talking before the child is ready, and that's what I need to say, because there's many that are verbal that
yeah,
may not be elaborative, initiative, and expressive, Janine, but they're quiet, one or two words. That we're working on verbal more. And kids will, the bridge is fluid. You may be verbal in one setting and shut down in another with an individual too. So it changes
yeah.
from person to person and setting to setting. But it's amazing when children, teens begin to understand their difficulty, their social communication difficulty, and how empowered they feel when they see, oh, wait, I am on the bridge. I may not be verbal here, but I'm able to do this, this, and this. And you see them sit up higher. You see them feel more proud. You see them like willing to do it. So if you have an avoidant child, it's because what's expected of them is too much and or they don't understand.
Yes, that makes so much sense. What do you feel like schools can do to make a more supportive environment for kids that have SM?
So there's two key concepts. And again, thank you for that question. Comfort precedes communication, and
Mhm.
progress doesn't tend to occur in a group. So, what does that mean? Our 504s, our IEPs, our SHMIEPs, which are non official plans, but in like private schools that don't necessarily use IEPs or 504s, we have to set the classroom up, like kind of like set the table, set the classroom up with the respecting of comfort away from the group and doing strategies there. Like, for example, the buddy process, pairing and grouping with 3 to 5 children the child can sit with, be paired with, and grouped with in small groups and in large groups. So, the buddy process, parents focusing on those buddies as outside get togethers to build that social connection. So,
Mm.
comfort, connection, communication, the 3 C's. So through the buddy process, the get-togethers with them out of school, after school, in clubs, in activities, and small groups in the room doing either a pull-in with another staff member if it's not enough staff. We call that the spot in the room. So to do the strategies, asking a choice question, using visuals, using a peer as an intermediary if they can, using the script approach, the write and read and show, or the write and read and the write and read, like the write and show or the write and read. So depending on where they're at on the bridge. And small groups out of the room, friendship groups, lunch bunch, recess bunch, clubs, activities, meeting for a math club, reading for going, meeting the teacher after school in the art room because she loves art, or the chess club for the child that loves chess. And you know what's going to happen? As these children age, Janine, and I know you see this with ASD, they find their people through their areas of interest.
100%.
That's where
They
the
really do.
groups.
Yes, and I just from personal experience, I have 2 children on the spectrum. My daughter was just diagnosed last year,
Oh,
and she's
wow.
25.
Okay.
And she was studying musical theater in New York City, and that was her thing, that was her special interest.
There you
And
go.
it's the now looking back at the symptoms that I know she had, she was able to blend in and do what she needed to do within that community, which was a beautiful thing. But it's kind of like sometimes when those special interests run their course, then you see somebody crash and burn.
Yeah, like when you put them in this situation, right? Or they're in this
Mhm.
situation as your child, as your daughter aged, she was making those choices. But for younger children and early teens, we're setting the world up. I call those silent goals. The teachers are organizing the clubs or suggesting to come in or do for the art class, or doing chess at lunch with a couple kids, or a lunch bunch, and they're doing interview questions. But after that comfort is there and they're with that child enough and they don't look anxious, the ASD
Mhm.
part for the child with SM and ASD, they just don't get the social nuances. They can't
Yeah.
continue that friendship, the true friendship. So that's why having them interact with peers through reading directions or doing or teaching, like I have a lot of kids that I work with on the spectrum who are able to teach others things. They like that leadership role. They can kind of read the recipe or read the directions or teach someone how to do something, right?
Yes.
Like in math, to be able to figure out math problems. It may not be friendshipy like maybe you and I think about. What are you doing after school today? Or, that's so funny, and laugh appropriately. That's something they have to almost learn through the conversations every day of, like, I have to teach kids when they're walking around to say, "Hey, Johnny," instead, they'll walk around with their head down because they don't even think to do it, a lot of them.
Yes, yes, and, I've noticed, so my son, he's 27 and minimally verbal, and has ASD. I've noticed that now that he's older and he can follow, like, multi-step directions and things like that, and if I tell him, "Go tell dad," or "Go ask dad if he's ready to go," he'll stand there in front of me and say it out loud, and I'm like, "That's really good, I like the way you said that, but I forgot to tell you, you have to go and stand in front of dad and say, 'Hey, dad,' and make sure you have his attention first." And so when you started talking about that
Yeah.
reciprocal, communication, I was like, "Oh my gosh, I was doing that." Like I catch myself still doing that and forget that that's part of it.
And so some of the things, like what you're saying, is building that independence and decision making, and having them, as they've practiced it enough that we've, like, step by step, I love how you phrased it that way, that they begin to figure it out. So like when we do
Mhm.
action plans to go to Dunkin' Donuts or Starbucks to get, a decaf coffee for them, or hot chocolate or a donut or whatever, some of them look lost. Like, what do I do? So we actually have to, like, role play it, social stories for our kids
Yes.
with SM and ASD. And when they're if they're nonverbal, we're working on handing and taking. Parents asking a choice and might say, "Do you want red, or do you want strawberry or chocolate?" No answer, strawberry or chocolate. Tell me, and lean in as the intermediary. So even if they have ASD and SM, they have to still utilize that. But for kids with SM, it becomes something they understand, because when they're not anxious, they have those skills, Janine. So
Yeah.
that's what I want your audience to understand, and why I was excited to be here, is because we have so many that have SM but misdiagnosed with autism when they don't have autism. But the evaluator keeps saying we can't evaluate because they're mute. So they
Ugh.
blame symptoms on being autistic or just SM when they may have both or either. So we see so many evals that are just wrong. And so that's honestly why we got into it so many years ago, to be able to assess kids and do these testing, because we are able to accommodate them using the strategies of progression that we know how to do. So it's important to tease it out. And this just happened to me the other day. I had a 2-day intensive with a family. Never, ASD was never brought up. Child was in treatment for brave talking for a year. Never made the progress beyond some words here and there, never could get the social piece. And it was so like, wait, this kid's on the spectrum. So luckily we were able to get
Mm.
this testing done in the office, and yeah, she's on the spectrum. And that
Wow.
was why it wasn't working, the traditional kind of get cozy and it happens, ask a
Mhm.
choice question, use the visuals, desensitize them, because the child didn't understand the social nuances. She didn't know how to have a true friendship. And her sensory is so overwhelming that she shuts down in loud, large lots of environment. She's not being defiant, which she was misdiagnosed with. She just can't function in those environments.
Yeah. Oh, that breaks my heart for that poor kiddo and those
It's
parents.
all the time where they
Yeah.
misunderstand the children's lack of talking, and they therefore, it happens all the time. I did a school consult recently with a teenager, 15, never brought up ASD. No one ever brought up ASD. She has no desire to have friends. She can talk. Remember, I said many of them can talk. They're just not conversational. And
Mhm.
some of them shut down, many of them in these louder, and they have nothing to say to so many people because they
Right.
don't have the social like nuances. They can't talk. And that behavior became very learning conditioned when they were probably shut down and there was so much attention to speaking, they then became avoidant of it. So it's really what came, you know what I mean? Came first, the chicken or the
Yeah.
egg.
Oh my gosh, that is a lot to try to, untangle
Yep.
for you guys. So what do you recommend parents do who are just starting out? Like, let's say they have a 2-year-old or a 3-year-old that isn't speaking on time. What do you recommend that they do? Who should they
Yeah.
see?
So if you have a 2 year old, let's say, and they're not speaking, and you're like, does this child have SM? What I would say is that child's speaking at home, because I would be very cautious with a 2 year old to label them with SM. I would
Yeah.
say to talk to your pediatrician, go to a developmental pediatrician to see where they are developmentally. And
Mhm.
always compare, what is this child like at home in the coziness of their home with their cozy people versus what are they like out and about. Now, I mean, we can do a whole nother podcast on the effects of COVID to a certain, population of kids that lack
Right.
2 years almost of social communication engagement and learning those skills, right? And that
Yeah.
delay that occurred in so many age ranges. And so
Mhm.
that's a whole separate conversation. But I would be very cautious to label a 2 year old with SM. So, what are they
Mhm.
like at home? And also do your homework, read. The Selective Mutism Association has resources. The Smart Center, we have a whole resource section. I have a podcast. I was almost going to say an amazing podcast, but the
It is amazing.
well, you know what? You know what, Janine? I think it is because I have 30 years of stuff in here and
Yeah,
I needed to
yeah.
get it out. And as much as I love to write my blogs, and I swear I write a blog a day, I love writing because I'm taking all my thoughts and putting them on paper. I love talking and I love explaining. And I think really doing your homework and not to see this as talking and get them to talk, understand why they may not be. I mean, we do treatment all over the world, whether it's coaching and training or we're licensed in through the SIPAC in multiple states. The first step is seeing a clinician that understands. So have a series of questions to ask this clinician about your child, about like why they may not be talking. What is your approach to treatment? What is your success rate? How many kids have you treated? You're the same in your industry because you want to go to
Right.
someone that sees this, in my opinion, as a social communication anxiety. That's where mutism is a symptom and not something you just focus on, because you've got to understand. And once you begin to understand, especially with young children, it falls into place so much quicker than you realize, because the teachers begin to understand. They have their accommodations and interventions in place. The parents understand how to support their children out and about in the real world, in stores and restaurants. They educate family members. They have the get togethers. They know how to bring their child into social communication. And all of a sudden, it's like, whoa, happens. I mean, it makes sense. And if you are in a treatment and it's going months, and I hate to say it, years and very minimal progress, you need to back
Yeah.
up to move forward. And you see this with your population.
Yeah, yeah. I mean, I've seen it with my own son where, speech therapy just didn't work. It didn't work or stopped working or, and you often go, "Well, gee, I wonder, is it apraxia? Is there can you have both?
Yeah.
Can you
And
be?"
I think it's
Yeah.
important. I think what you're saying is if you do have an underlying speech and language difficulty, right? And we did research on speech and language to be able to test mute children. How do you test a mute child for speech and language? We've developed an evidence based protocol for that. You may need to see a speech and language pathologist as part of the multidisciplinary treatment. Just like for sensory issues, you may be seeing an OT for
Yes.
multidisciplinary treatment. And so it's a
Yeah.
whole team that's working with this child on different angles. But
So you see OT being effective as
well,
well?
it's from a sensory perspective, not the
Yeah.
treating the SM. I want to be clear. If
Yes.
we understand their sensory needs, whether they're, all the different avenues of sensory, which you can do, you're an expert in with the, you understand the sensory component. Understand that I'm dealing with a population that they don't even see the sensory component. They're so focused on the mutism that when you pull it apart and you see that sensory aspect and you get that differential, and we screen for that in our selective mutism evals. So what we do is we screen for it and help families know where they need to go if they need additional testing or resources. That's the whole point, is you want a conceptualization of your child. You're not treating a disorder, you're treating a child.
Oh, I love that. Oh my gosh, that you've got a couple of things here that I just want to make a hashtag of, like, and that's one of them. You are not treating a disorder, you're treating a
Yeah. And the
child.
whole point
We
of the
can't
name
forget
of a
that.
disorder is for insurance reimbursement and school-based accommodations and interventions.
Yes.
You're treating the person, it's not the disorder.
Yeah. Yeah.
And that's
Absolutely.
why no
Oh my
two
gosh.
kids are the same.
Yeah. Yeah. Can you tell me maybe a story without any identifying information, obviously, about, one of your success stories in your
Oh my
office?
gosh. Yes, I have what age range?
Oh, I don't know, whatever. I'll let you choose.
I mean, there's so many different avenues. I want to try to give you like kind of like, a complicated case, right? You have a child that comes in, she's 7 and a half years old. She had gotten an evaluation for an IEP before she even got to me, for selective mutism. But when we did our selective mutism evaluation to be able to understand her, we realized she was talking to some kids in school. She was running around outside at recess. She was able to talk. But in the classroom, she was avoidant of academics. She wasn't starting and completing work on time. She was kind of shut down around the academics and she would get mute. So when the teachers would ask her anything about, you know, questions academically, she would shut down. And the reason teachers were difficult to talk to, because they were the ones asking the academic based questions where she was really having a difficult time. And we picked up on that. We have something called the Selective Mutism School Evaluation Form, where we screen for how are they communicating with peers and teachers in small groups, large groups, but also we ask all these academic based questions because we see so many kids with SM that have some of these learning difficulties that affect their processing. And so what ended up happening was when we did our eval, we're like, whoa, their IEP and their behavioral plan for school was all focused on brave talking when they were not seeing how the academic piece was a challenge for this child. And the reason this child wasn't verbalizing with teachers was because it was so academic based, the open-ended, thought-provoking what, when, where, and why questions, and the child couldn't do it. So she
Yeah.
became avoidant, she became silly and goofy, and would look at her friend's paper. Anyway, to make a long story short, we asked for an IE, which is an independent educational evaluation, to do a full battery. And in that full battery, we saw she had ADHD, she had some processing difficulties, and she had dyslexia.
Oh my
And
gosh.
once we developed her school-based accommodations and interventions around the understanding, she made incredible progress for communication, because we had to teach the teachers how to engage and communicate with her and how to set up the academic. She had to have special education for the academic difficulties, not just for the not speaking. And we had to respect where she was on the bridge. So she was mute with teachers. So we had to use peers as intermediaries. And we teach the teacher something as simple as, do you want red or blue? And avoiding eye contact. You want red or blue? No answer. Red or blue? Tell Rebecca. And we prompt her to tell her peer who she's already verbal with and comfortable with, and
Yeah.
then repeat with that eye contact. Oh, red. And by doing that, you're minimizing their kind of sense of expectation, because a lot of kids with selective mutism feel that huge expectation for needing to talk, because that's all they talk. That's all they hear. Talk, talk, got to talk. If you talk. So they
Yeah.
develop that mountain out of a molehill of avoidance to talking, and they become, a lot of them, speech phobics, where they're stuck in the nonverbal. So the treatment plan had to be about understanding. So the child, I don't even see her anymore. She's doing great. The parents update me. They love, I have really I'm sure you and I connected from the beginning, and I'm sure you're similar where you have these relationships with your families. And even when they're kind of through their treatment, they still keep in touch and let me know
Sure.
all the great stuff.
I love that.
And I'm so old now that some of these individuals that struggled are actually, some of them going into like psychology field, lawyers, doctors, like
Ah,
achieving their biggest dreams. And we have people like counselors at our community camp and clinicians that I treated when they were little. And they're so
that's
passionate.
amazing.
In fact, this year we have a practicum student who I treated his sister. He was 3 and he's now a practicum
Wow.
student and she's a PsyD. So
Oh my
I know it's just, I get chills talking about it because
yeah.
I think the message to your listeners is you don't need to remain mute. No child or teen should ever remain mute, and that
Mm.
you have to have an understanding of who they are and conceptualize them as an individual to meet their needs. And we didn't talk about the importance of parenting because being an authoritative parent is so critical to this population as it is to ASD.
So tell me about that. We have a couple of minutes.
I have parents that, have that authoritarian kind of my way or the highway. It's bedtime, go to bed now. You need to do this, you need to do that. And the poor child is like this, like, has no control in their life and they're overwhelmed and they can't do things. And it is a slower rate of progress in treatment. And the children
Yeah.
become very avoidant to their parents. They won't make progress around their parents. They lose trust. They feel very small.
Mm.
And then you have the permissive parents. It's like no structure, consistency, routine, and predictability. And the child feels out of control. And they often have that lack of respect. The progress is slower. Whereas the
Yeah.
authoritative, the structure, the consistency, the boundaries, the routines, the respecting them, you know what I mean? Giving them choices with boundaries, parenting with a focus of giving them that choice and control within the frame of your boundaries is what fuels progress. So much of our work is training parents and having just even the way you talk to kids, like avoid can you language. Can you do this? First, let's do this. That direct way of speaking to them in an upbeat, positive way. First, can you or you need to? I talk to parents about just how they project their wants and needs from their children can cause the child to either, shut down and avoid or act out because of how they are perceiving.
Oh, 100%. I think I would say, I have a couple of clinicians in my practice who work directly with children. I work mostly with the parents. And that's the biggest thing that I find is, there's a new term in the autism world that started in the UK called PDA, pathological
Oh my
demand
God, 2
avoidance.
patients recently with it.
So let me just tell you my theory on this, and my
Oh
listener,
my
you can send me
gosh.
mail if you want to. Tell me. Um, I've been teaching how to combat this so-called
Yeah,
PDA for years, and what I call it is developing trust.
yeah,
Develop trust with your child.
yeah.
Don't treat them like they're, anything but a precious human being, and that doesn't mean they get to run all over you.
I love
But like you were
that. You're
saying,
right.
you gotta
Yep.
you gotta balance the boundaries
Because their
with
avoidance,
choices.
right?
Yeah,
Their avoidance in so many cases is a result of them being unable to do it and avoiding
yeah,
it versus an understanding way and understanding what they can do. But they've got to break the cycle, right? So you have to train parents on how to break that cycle. Of,
yeah, and choices is a brilliant way to do it. I when we would run up against an issue with my son, if he has to take his pills in the morning and I hand him the cup of pills and say, "I need you to take these," he's not gonna take them. Or, "Can you take these?" Not gonna take them. He doesn't really want to, doesn't want to stop whatever he's doing. But if I say, "Hey, I'm gonna leave these right here," and this is taken step by step for us to get here. If I say, "Hey, you wanna take your pills now or in 10 minutes?" 10 minutes. He usually almost always picks 10 minutes,
yeah.
but every once in a while, he'll grab them and just take them, and I'm just like, "Awesome, thanks." But, I don't make a big deal out of it. I just treat him like a person, and then if we're ready to go out the door somewhere and they still haven't been taken, I'll be like, "Oh my gosh, look, these have to be taken before we go. So whenever you're ready, we gotta go in 5 minutes. You got 5 minutes."
Yeah, no, I love
And
that. That's exactly
and then I
right.
walk away,
Yeah.
or I mean, with him, I don't walk away completely because you just never know. But he ends up taking them. And and I'm not telling parents go ahead and do that and they're just going to do what you say. We have scaffolded this over years, but yeah, I think it's so important that your kids are not trying to hurt you. They're not
No,
trying to
we
defy
weren't
you. They're
born to
not.
torture you.
That's right.
And
100%.
that's where we go back to look, listen, and learn. Look at what they're doing and look how they're responding and look at them. Like, what, not stare at them, look at them, but kind of like try to understand why they're doing something. And if it's not working, you got to step back and start to figure it out. And that's where finding a clinician that helps. You mentioned school a lot, and I just want to make sure before this ends that I used to, prior to COVID, go around the country and do these conferences, Selective Mutism in the School Conference. And we brought them back. We're doing a virtual one with continuing ed credits on April 4th, and then it'll be on demand for a year. And it's a 6.5 hour conference, but it's a great way for school professionals and parents and clinicians to learn about how to support a child within the school environment. How do you test a child? What are the comorbidities you look for? What are the symptoms? And ASD is definitely mentioned throughout that entire, presentation, because it really is. There's so many more, originally they used to say, if you have autism, you can't have SM. And that is just not true. You
Okay.
absolutely can have both. It's just if you view it as mutism, then it's like, okay, it's better not accounted for by an anxiety. It's something else, autism, but you can have both because it's a social communication anxiety disorder. And although autism has that neurodevelopmental aspect of it, they do get anxious that causes them to shut down and avoid so much of it's sensory for so many of our kids. But or the language, the speech and language, to be able to have a conversation. I have kids that can shoot off, especially with ASD, they can shoot off full sentences. They can just initiate something. But when you ask them a question, nothing.
Yeah.
And that's
Yeah.
where the scripted language comes into play, because I say this all the time. I say this at Communicamp, and when we're doing trainings, I go, what's the percentage of kids or teens? Kids and teens are the same for me,
Right.
and adults, because we deal with adults. If you're verbally responsive, let's just say, what are the chances I can help you become initiative? And the answer is 100% if they can read or sight read, even picture read. Because if a child can respond, they can initiate by reading. So, hi, do you have, or what is your favorite? Because they're already verbal, they're not afraid. When I see kids on the spectrum, they tend to be more initiative than responsive. It's the opposite almost. So that's interesting
Wow.
because they can speak about, like, I had a little boy in my office and he was completely mute playing. I was trying to do sounds, words, nothing. As soon as I brought up a ceiling fan, which I knew he liked, he rattled off everything about that ceiling fan. So that became our springboard, our diving board into more speech. So we had to train the teachers that maybe he would show them a different type of ceiling fan, or he'd walk around the school and be able to tell them things about the ceiling fan. Then we go into other questions.
So you're using the interest as a window in.
Yes, it's like, there I am. I'm diving into it. So it's almost like their springboard, just like a child I had the other day who she just loved Harry Potter, Harry Potter, Harry Potter, Harry Potter. We used her interest of Harry Potter to leap into more communication about school and about her friends and about other things, because that was her springboard.
Yes. Oh, that makes so much
Yeah,
sense to me.
like a little diving
I
board.
love. Yeah. Well, and so where in the country are you, Dr. E, so that people can
Yeah, so
contact you?
we're in Pennsylvania, in Philadelphia, but we do telehealth all over the country and all over the world. Selectivemutismcenter.org or communicamp.org, because I'm very proud of our intensive group treatment and parent training program, because we are the only program that offers all day parent education in the entire program. Because to us, it's all about educating parents. Uh,
Oh, yeah.
and
When's your next Communicamp?
well, we have one in next week, March, but we have 3 in the summer, 1 or
Nice.
2 in the fall, and 3 winter camps. So we have
Okay.
all different ages, and we have a teen program for teens, and many teens can speak, some can't, but we're working on initiation, elaboration, expression, conversation starters, conversation expanders, friendship building, how to find a job, how to get a driver's license, how to find a college. Like, we're working on real life teen stuff because many of these kids can speak. It's just about these other avenues of social communication. And we often do have kids on the spectrum in these camps. They have to be pretty high functioning though, because they have to be able to work within a group and not have like a one-on-one aid within the program. They have to be pretty independent.
Yeah, that makes sense. Absolutely.
Yeah.
Well, Doctor, I'll link to all of that in the show notes.
Yeah, and I'll have, we'll send you stuff, but I'm just so excited because I have a daughter who's now a physician, married, thriving, living her best life. But I'm going to be honest, I have 4 kids. I'm going to be honest. If I had listened to what so many people told me about my daughter, who should have been, like misdiagnosed, told me she was not able to function in the world. I mean, I can't imagine. That's what fueled my passion, Janine, because my daughter wasn't that child, right? So she was able to do these things at home and was able to form the friendships and connections. But here I am, a parent. Let's say I wasn't a physician, and even physicians, I treat physicians' families all the time. You're being told things. So for me, the passion is about bringing awareness. And that's where like the Selective Mutism Research Institute came from, to be able to bring awareness and to educate and do the research so that people understand this is so much more than not speaking. And, I'm fortunate because I use my medical knowledge. And now I have my other daughter who's a full-time doctorate working at the center. And then,
oh, that's so cool.
I know all my kids are somewhat involved with what I do. Brandon helps produce the podcast. He's in marketing, and it's just really cool. My other son's software engineering. I mean, they all have full-time jobs except for Jenna. She works for me. We work together now. But anyway, awesome. I had to just say that because I'm so passionate about this field. And I always laugh that on an airplane, I hope they sit by the window because I sit on the aisle, and then I can go on and on. But you and I are similar.
We are. Well, I don't know if you know this. I grew up outside of Philadelphia on the Jersey side of the bridge.
Oh my God, that's right. That's right.
Yeah. Yeah. So of course, I mean, we both love to talk. Go figure. Well, Dr. E, thank you so much for coming on today. I really appreciate it. And we will be linking to everything that we talked about today in the show notes so that parents can just click. You're just a click away.
And also make sure you send us the final episode, because we're going to share your wonderful resource. We have so many families in Florida that have autism, and I'd love to be able to have another resource down there like you. You're wonderful.
Yeah, absolutely.
To refer to. So thank you so much.
Yes, thanks for being here. You have a great rest of your day.
You too.
The information in this podcast is not intended to be a substitute for help from a licensed mental health professional.